Good morning. My name is James Coulombe, and I have the honor of serving as the NIH Working Group Coordinator for the Gabriella Miller Kids First Pediatric Research Program. I'm here to give you a brief overview of the program and an update from the NIH perspective. The Kids First program was initiated in response to the 2014 Gabriella Miller Kids First Research Act. The Act and this program were named in honor of a 10-year-old Virginia girl who in her short life became an eloquent advocate for pediatric research. The Act ended taxpayer contributions to presidential nominating conventions and took $126 million of the funds already collected and transferred that money to a Pediatric Research Initiative Fund. It authorized appropriation of $12.6 million per year for 10 years to the NIH Common Fund for pediatric research. But an authorization is not an appropriation, as we learn every year, and we depend on Congress to appropriate funding every year for this program. Our vision for the Kids First program is to alleviate suffering from childhood cancer and structural birth defects by fostering collaborative research to uncover the etiology of these diseases and supporting data sharing within the pediatric research community. And the emphasis here should be on collaborative research and data sharing. We are operationalizing this vision by establishing a pediatric data resource populated with high-quality genomic and clinical data in an environment that facilitates collaborative research. The hope is to accelerate gene discovery and ultimately to improve diagnostics and treatment. Kids First is a trans-NIH effort with support through the Common Fund. The program is chaired by a group of institute leaders from NICHD, NHLBI, NCI, and NHGRI. Organizing and running the NIH side of the program is a working group of program officers representing most of the offices and institutes concerned with pediatric research. We wanted to point out the many different institutes that are involved because you can reach out to the institute representative whose mission best fits your project to learn more about the Exo-1 sequencing program, and you can find the list of those members in the link to the Common Fund NIH Kids First website. The working group is led by a smaller team of program officers, grants management specialists, a team from the Common Fund, and Valerie Cotton, a program manager who somehow manages to keep things organized. This governance slide gives you a view of all the components of the Kids First program. Each component of the Kids First program has representation on the steering committee, which is chaired by Virginia Papiano. Exo-1s have representation on the steering committee through their representatives, Wendy Chung and Charles Mulligan. The steering committee provides a forum to discuss and provide advice to the working group, and as necessary can be called on to formally establish milestones, develop uniform policies and procedures, and make major scientific administration decisions which are determined by a majority of the steering committee. In addition, we've recruited a group of 5 outside program consultants who individually provide advice to the NIH working group. Three major initiatives were established at the start of this program. The first was to identify cohorts of children and their families with pediatric cancer and/or structural birth defects to generate high-quality whole genome sequence data, which, along with relevant clinical data, would populate the resource. The second initiative was to build a data resource. Both initiatives have been implemented and are underway, and a third initiative was slated for future implementation, and we will welcome input on these future directions. This is similar information, but in a timeline of sorts for the Kids First program. We're in the midst of sequencing and building the data resource and plan to continue those activities through fiscal year 2021. We are now beginning strategic planning for the out years of the program, fiscal year 2022 and beyond. There are numerous possibilities. We may continue sequencing. We're likely to continue support for the data resource. But one thing we know is that it will be important to demonstrate the value of the data resource we've built. Some possible projects to consider are opportunity funds to support phenotype curation, funds to recruit or reconsent cohorts of affected children, data mining demonstration projects, developing animal models. Your suggestions will be welcome as we plan the out years of the project. Kids First has been working with sequencing centers at Hudson Alpha and the Broad for the last 3 years to support the sequencing of the Exo-1 cohorts. Both centers have the capacity to sequence cancer and birth defects projects, although generally our plan has been to assign cancer projects to the sequencing center at Hudson Alpha St. Jude to take advantage of their analytical expertise for identifying somatic variants. Assignment of project to sequencing center doesn't always work out exactly this way, but this is our general framework. The Kids First sequencing centers are being recompeted for 2019, and we expect to make new awards by next July. And just over a year ago in July, we funded the Kids First Data Resource Center. The overall PI is, of course, Adam Resnick at CHOP, leading a team coordinating development of the resource in collaboration with others at 5 different sites. Their impressive progress in establishing the data resource and opening a data portal for access to the Kids First data is the subject of most of today's meeting. To populate this data resource, these are the conditions that have been chosen for sequencing by the Kids First using funds for the first 3 years of the program. 5 data sets that are shown in blue are currently available to the research community. The remainder are in various places in the pipeline, and several should be available within a short time. Moving forward, data sets will be harmonized, stored, and made available by the Kids First Resource Center through the new Kids First data portal. Well, it became apparent to us that many of the data sets from the first years of sequencing had data use limitations that seriously limited data sharing, and moreover that in some cases these data use limitations were more restrictive than the original patient consents required. This last year we therefore made an effort to ask PIs to examine any data limitations attached to their samples, and going forward we have the expectation that the data will be consented for the broadest levels of data sharing and will prioritize our sequencing support with their data sharing in mind. This year we feel fortunate to be able to expand the variety of conditions represented in our sequencing pipeline with these 11 cohorts representing over 8,000 genomes. Our efforts this year have been magnified by trans-NIH collaborations with the INCLUDE program and with NICHD that are enabling us to expand the Kids First sequencing pipeline for this cycle. These are great examples of how working together with other NIH programs we can accelerate genetic discovery for pediatric research. Another way of magnifying our efforts has come from issuing program announcements for R03 grants specifically to support analysis of data sets that are either part of the Kids First data resource or could be included in the Kids First data resource. Projects aimed at development of statistical methodology appropriate for analyzing these data sets are also can also be proposed. These grants are double the size of a standard R03, and if they receive favorable reviews, are paid from institute funds, not from Kids First monies. So if you're interested, you can contact me or the Institute scientific contacts listed in the announcement for more information. You should also be aware that we will be reissuing this announcement, so there will be a different number in the future. Within just the last 2 weeks, we established an additional collaboration that we're real excited about with the NIH Knockout Mouse Project. This is a pilot program designed to take advantage of COMP's efficient gene editing production and phenotyping pipelines to produce mouse lines carrying variants of genes specifically identified using Kids First data sets. You can find more information in a recorded webinar about this pilot program on the Common Fund Kids First website. We are using the COMP pilot program to work out procedures and criteria to evaluate variants nominated by researchers using Kids First data. This workflow, we hope, will come in handy for future gene editing validation efforts in other model systems. So that's an overview and progress report from the NIH perspective. These have been really busy and productive years for the Kids First program, and we look forward to listening and working with the pediatric research community to make this a successful program and to build a valuable resource.